My name is Vanessa Baro, and the diet for this video will be the HCG diet. So what is the HCG diet? The HCG diet is also known as the human chorionic gonadotropin diet. And during pregnancy, the HCG is produced in the placenta, and this allows the fetus to access nutrients that it needs. So this diet claims that in overweight people, the HCG hormone will seek out the stored nutrients in the fat cells, which will allow the body to burn fat. And it also claims that you'll lose 1 to 2 pounds every day or 10 pounds every month, and it'll suppress your hunger as well. So some of the restrictions in this diet is that you can only eat 500 to 700 calories every day, and you have to administer 100 to 300 IUs of HCG hormone every day. So there are 3 main phases of this diet. There's the loading phase, the weight loss phase, and the maintenance phase. In the loading phase, you can start taking the HCG injections while eating a high-fat diet, and this phase will typically last for 2 days. Then there's a weight loss phase. You continue taking the hormone, but you can only eat 500 to 700 calories every day, and you have to have very little fat in your diet. Then the weight loss phase usually lasts anywhere from 3 to 6 weeks, depending on what your goals are and how much weight you want to lose. Then there's the maintenance phase. This phase, you stop taking the hormone and you slowly increase your calorie intake, but you still have to avoid high-fat foods and high-carb food for a few weeks. This stage usually lasts for about a month. And then there's the cycle in and out of the diet. This isn't really a phase, but the people who usually follow this diet, they'll do the diet for about 2 to 3 months, and then they'll cycle off for a few months, and then they'll come back and continue the diet. That's typically how it works. Alright, for the cons of the HCG diet, it's important to say that the hormone has only been approved as a prescription drug for the treatment of female infertility and for other medical conditions, not obesity. And in 1976, the U.S. Federal Trade Commission ordered to discontinue the claim that the HCG weight loss program were FDA approved. So since 1976, it has not been approved. So in 2021, a case study was done on a 44-year-old woman after 2 months of following the HCG diet. And long story short, she had blood clots. And she also experienced headaches, fatigue, irritability, and depression. And in some severe cases of people who follow this diet, they had strokes. In 2020, a 46-year-old woman who came in with complaints of shortness of breath after following the HCG diet on and off for 5 years. She usually cycled for about 45 days and then she cycled off. It turned out after doing several tests, she had heart strain and acute vein thrombosis in her right leg and chronic deep vein thrombosis in her left leg. So what are the pros of following this diet? There aren't really a lot of pros. You'll definitely lose the weight, but the main reason why you're even losing any weight is due to the low restriction, like the low calorie restriction of the diet. Any diet with this amount of restriction of the calories, you will definitely lose weight, but you'll have serious side effects like what I mentioned. There are also some side effects such as heart palpitation, heart strains, like I mentioned, blood clots, breast tissue growth in men and soreness in women, vaginal bleeding. So at the end of the day, I would say don't do this diet. Having a well-balanced and nutritious diet while incorporating exercise should be enough to lose or maintain a healthy weight. Stay clear of this diet, please.